Hello and welcome to Pregnancy Info. A cryptic pregnancy is when you don't know you are pregnant. It can happen if you have irregular period, don't know the common signs of pregnancy, or get a negative result on a pregnancy test. A cryptic pregnancy or stealth pregnancy is when you are pregnant but don't know it. It's even possible not to realize you are pregnant until labor stages. It's most common to realize you are pregnant somewhere between 4 and 12 weeks of pregnancy. This could be because you have symptoms of pregnancy or because you missed your periods. A positive result on a pregnancy test can confirm pregnancy with a cryptic pregnancy. Nothing trigger you or believe you are pregnant. This could be because you don't have symptoms of pregnancy or mistake symptoms of pregnancy as a virus, or your pregnancy test result was wrong. Who is at risk for a cryptic pregnancy? Anyone can have a cryptic pregnancy. You may be at high risk if you, number 1, recently gave birth. After you give birth, it may take several months for your periods to return, and you may not ovulate if you are breastfeeding. This can give you the false impression that you are completely safe from pregnancy. It is difficult to predict when you will first ovulate during breastfeeding and become fertile again. Have a condition like PCOS. If you have PCOS, your periods are unpredictable because skipping periods is normal for you. You may not realize you are pregnant if you miss a period. Use birth control. If you use birth control, you may mistakenly think you are pregnant, protected from pregnancy. Even when you use it correctly, there is a small chance of failure. Are in perimenopause. You are in your 40s, you may think you are too old to get pregnant or mistake pregnancy symptoms for menopause symptoms. Have been never pregnant. If you have never been pregnant before, you are less likely to know that what being pregnant feels like. This means pregnancy could be unnoticed for longer. How common is a cryptic pregnancy? Cryptic pregnancies are uncommon. Studies suggest about 1 in 475 pregnancies go unnoticed until about 20-week gestation. About 1 in 2,500 pregnancies go unnoticed until delivery. Will a cryptic pregnancy show on a pregnancy test? You should still get a positive pregnancy test with a cryptic pregnancy. However, using an at-home pregnancy test correctly is the only way to get an accurate result. If you don't use it correctly, you may get a false negative. Be sure to follow the instructions on the package and wait several days after you miss periods to take an at-home test. If your symptoms don't agree with your home pregnancy test results, it's always best to have a healthcare provider confirm pregnancy with a blood test. Do you get your period in a cryptic pregnancy? No. A cryptic pregnancy is similar to a regular pregnancy in that you don't get a true menstrual period. However, you may experience implantation bleeding or abnormal pregnancy bleeding and things is your periods. Symptoms and causes. What causes a cryptic pregnancy? There are several reasons why you may not realize you are pregnant. Some of the causes are: an at-home pregnancy test may have shown a false negative result. You don't have pregnancy symptoms. You don't notice the pregnancy symptoms or dismiss them. You don't know the symptoms and therefore don't know you are pregnant. What are the signs of cryptic pregnancy? If you are a cryptic pregnancy, the symptoms are the same as those for unknown pregnancy. The key difference is that you don't realize pregnancy is causing the symptoms. For example, you may think you are nauseous from eating a certain food or that you tried because you need to sleep more. Other symptoms of stealth pregnancy include missed period. While a missed period is a clue for most people, this isn't always the case. If your periods are always irregular, you may not realize you are missed your period due to pregnancy. Spotting or light bleeding. You might experience light spotting in early pregnancy and mistake it for a period. False negative pregnancy test result. This means you are actually pregnant, but the tests say you are not. If you don't use an at-home pregnancy test correctly, you may get an inaccurate results. To be sure, it is always best to consult a healthcare provider to confirm your pregnancy. Weight gain or swollen belly. You may not notice you have gained weight due to being pregnant, or you might attribute an unusually bloated belly to eating a certain food. Fetal movement. Fetal movements usually aren't noticeable until about halfway through pregnancy. If you have an anterior placenta, the placenta is the front of your belly. This can make it harder to feel kids. In the case of this cryptic pregnancy, this could be why you don't realize you are pregnant. Not knowing symptoms of pregnancy. If you are very young or have developmental disabilities, you may be unaware of common signs of pregnancy like a missed period, tender breast, or nausea. How long does a cryptic pregnancy last? Most people realize they are pregnant about 20 weeks into the pregnancy. However, it's possible to be unaware you are pregnant during the entire 40 weeks of pregnancy. There have been cases where a woman goes to the emergency room with pelvic pain only to discover she is in labor. Some studies suggest cryptic pregnancies are more likely to result in preterm births due to the lack of prenatal care, poor nutrition, or lifestyle choices. Diagnosis and tests. How is it diagnosed? Pregnancy care provider diagnose cryptic pregnancy like they would a typical pregnancy. Some of the ways providers confirm pregnancy include ultrasound, blood test, urine test. Management and treatment. How is a cryptic pregnancy treated? Treatment for cryptic pregnancy depends on when you realize you are pregnant. If you are still months away from delivery, a pregnancy care provider will try to catch up on the prenatal care you have missed. This could include blood and urine tests, ultrasound, measuring fundal height, physical exam, nutritional and lifestyle counseling. What are the complications of a cryptic pregnancy? Complications of a cryptic pregnancy are a direct result of not knowing you are pregnant. Some of these complications are: number 1, no pregnancy care. Since you don't know you are pregnant, you have not been seeing a provider for your prenatal care. This means you didn't have the necessary blood work, nutrition, counseling, ultrasound, or other support you need for a healthy pregnancy. Not knowing you are pregnant could also mean going into labor on your own without help from a skilled healthcare provider. Lifestyle adjustments. Smoking, cigarettes, and drinking alcohols are harmful during pregnancy. Since you don't know you are pregnant, you may use these substances to take other medications and supplements that are generally unsafe during pregnancy. Higher risk of medical conditions. You won't receive the care of tests necessary to diagnose certain conditions like gestational diabetes or preeclampsia. High risk of congenital conditions. The fetus is at risk of congenital conditions because you didn't receive genetic tests or other evaluation that help diagnose birth disorders. Preventions. You can prevent cryptic pregnancy. The best way to prevent a stealth pregnancy is to be aware of your body and sexual health. If you believe there is any chance you could be pregnant, it's always best to take a home pregnancy test or visit a healthcare provider for a blood or urine test. Hope you have found this video useful and be aware of all the hidden facts about cryptic pregnancy. Must share this information with other females that they can understand that can also happen. Take care. Bye-bye.